This presentation will go through how to perform the active cycle of breathing technique. The active cycle of breathing technique is a combination of different breathing techniques that can be put together in different amounts to suit your patient's requirements. It consists of thoracic expansion exercises, breathing control, and forced expiratory techniques. Forced expiratory techniques are a combination of huffs and breathing control. The active cycle of breathing technique works by increasing lung volumes to get air behind secretions and by increasing expiratory flow rate, which helps to shear the secretions off the airway walls. It is used when the patient has evidence of impaired airway clearance and needs extra assistance to clear their lungs of secretions. There are no specific infection control considerations for the active cycle of breathing technique. In terms of patient positioning, it really depends where you're trying to clear secretions from. Generally, it is done in the upright position, possibly sitting in a bedside chair. The improvement in FRC achieved in an upright position will benefit the airway clearance intervention by helping with lung volumes and getting air behind secretions. For how to perform the thoracic expansion exercise component of the active cycle of breathing technique, please refer to the thoracic expansion exercises presentation. Breathing control is a relaxation technique, where the patient undertakes relaxed breathing and may incorporate specific relaxation techniques if required, or may just consist of quiet breathing. This will depend on your patient, their level of breathlessness, and their level of anxiety. For example, if you have a very breathless or very anxious patient, there will be more breathing control built into the cycle. Some strategies include using positions of breathlessness, or getting the patient to close their eyes and imagine themselves somewhere safe and warm. Ask them to become aware of their breathing, but not to try and slow it down. This will only heighten their anxiety about their respiratory rate and worsen their breathlessness. The forced expiratory technique is, as the name suggests, a technique of forced expiration. It is done with an open glottis, which differentiates it from a cough, which is performed by building up pressure behind a closed glottis. The theory is that it creates a high expiratory flow without the peripheral airway closure that can be found in a cough. It also requires less effort than a cough, so can be more beneficial in patients with fatigue or pain. For patients with higher sputum load, more FETs might be seen in the cycle, and in patients whose airway clearance is impaired or exacerbated by reduced lung volumes, more thoracic expansion exercises might be included instead. Once they have completed the intervention, it is important to advise the patient of this and to ensure they are returned to a comfortable position. The prescription will depend entirely on your patient. Patients with breathlessness will require more breathing control, those with reduced lung volumes will require more thoracic expansion exercises, and those with more secretions will require more FETs. Those with high secretion loads may need longer treatment sessions more regularly throughout the day. Those who fatigue quickly might require shorter sessions more frequently throughout the day. In general, keep going with this intervention until the chest is clear or the patient is fatigued. For this reason, you will need to continually reassess throughout the treatment. How the patient goes with the intervention will determine how you prescribe it to the patient. Make sure when documenting this intervention that you include what components you have used and how much of each, so that the treatment would be entirely reproducible by another therapist. Also make sure the patient knows exactly what is expected of them. For this intervention, it might be beneficial to write down the prescribed cycle for your patient so they can remember and continue independently. Once a patient is experienced in the active cycle of breathing technique, they will likely be able to adjust the components themselves based on their current symptoms. Let's have a look now at how to teach your patient to perform a huff. The specifics of thoracic expansion exercises and breathing control are covered in other presentations.
So now we're going to demonstrate a huffing procedure. So what I need you to do is take a moderate sized breath in, keep your throat and your mouth nice and open, and so it's like you're fogging up a mirror. Some of the common mistakes patients make is to keep their throat closed, in which case you get you want that nice clear sound. If that's happening, sometimes using a spirometry mouthpiece can help fix the problem. So this time I'm going to get you to put this in your mouth. And the same thing. Good job, and that way it ensures their mouth and their throat is kept nice and open. Another trick, if they're not generating enough force, is to actually use a tissue. So you can start with a tissue quite close to the patient's face, Now see if you can make that move when you huff. Big huff. Good. And then you can move it further away and get them to still try and make it move.